Welcome, everyone. Thank you for joining us today. I'm Christine from IP Fabric, and I'm here with my colleague, Zach Brown, one of our solution architects, to walk you through how network assurance plays a critical role in HIPAA compliance. Zach, please introduce yourself for our audience today.
Good afternoon, everyone. Nice to meet you. My name is Zach Brown, and I am a solutions architect with IP Fabric. I'm based out of Charlotte, North Carolina. I'd like to thank you all for attending, and I really appreciate your time this afternoon. And hopefully after the webinar here, you'll have some value to take back with you about HIPAA compliance.
Sure thing. And just to point out, there are some docs and there is a Q&A, so feel free to make use of those resources. They should be available for you, and feel free to leave us any questions as we go. So I'm going to set a little bit of context, and then we will be demoing how IP Fabric actually helps you deliver the evidence you need for HIPAA compliance. But let's start with a kind of vision of what we're working with, right? So in 2025, digital healthcare is the norm, from telehealth to virtual nursing or real-time imaging needs. Care is now seamlessly connected, right? And AI is becoming more embedded in our clinical workflows, diagnostics, and patient interactions, all aiming to boost satisfaction and improve health outcomes. But of course, like any digital evolution, this does bring risk. Every digital touch point is a potential vulnerability. And while it might be seen as your background utility, the IT network is actually the backbone of this modern healthcare. It's what's behind those shiny apps in your doctor's iPad, right? So disruptions here, as Zach knows all too well, can delay procedures, overload staff, and of course expose sensitive, highly valuable electronic personal health information. So these systems must be secured to protect the data they carry. Personal health data must traverse networks to be usable, right? And that makes the network a very important attack surface for your business. So to kick off and get you guys all involved in this webinar, we want to start with a poll. And first, we are going to ask you should see the poll pop up in the poll tab. What is your biggest challenge when it comes to HIPAA technical safeguards? What are you struggling with? What do you want answered? We'd love to know so we can share those results and know how to help you best as well. All right, so I do want to just underpin also how critical, the criticality of these networks that IT staff are managing in healthcare. The network becomes a mission critical system when it comes to remote device monitoring, Internet of Things, quick access to health records, access to patient data, all these things I've listed here. And this demands continuous connectivity. And IT teams need to balance this performance and availability with security. But it's rarely simple. Healthcare networks are notoriously complex. We're talking about multi-vendor environments, a mix of cloud and on-prem networks, legacy platforms that you can't just easily replace, and an explosion of third-party tools and bring your own device policies that make everything all the more complex to handle. And security and performance, we need them to coexist in this balanced way. So with healthcare teams trying to play this balancing act to deliver care quickly and protect the infrastructure that makes digitally delivered healthcare possible, it's not an easy task when resources are limited and visibility is fragmented. Actually, 41% of healthcare IT professionals believe that their organizations allocate insufficient financial resources to make their cybersecurity strategy effective. This was from a Proofpoint survey. We'd love to know if you agree. Feel free to leave it in the chat. And it's in this kind of environment that network misconfigurations, segmentation gaps, and unpatched systems become scary ticking time bombs, which brings us to the topic at hand, compliance. So compliance, not just as a checkbox exercise to pass the next audit, although you definitely need to do that, but as a framework for securing the critical infrastructure that underpins your business all the time. Because if healthcare systems go down, this impact will ripple across society. And in the US, HIPAA is the cornerstone of that protection, right? It doesn't exist in a vacuum. It intersects with internal policy. It intersects with NIST2 and other security frameworks that you might be using, and the evolving needs of electronic health personal information exchange. And at the heart of all these regulations, it's the same message. Here are the systems that handle sensitive patient data. And today we'll focus on HIPAA in that network context and how you can bring your network into compliance proactively with everyday audits, not just when you're scrambling to meet the audit deadline. All right, so what's changed about HIPAA in 2025? Why now, right? Zooming out once again, a mid-2025 report on the state of cybersecurity in healthcare from Fortified Healthcare Security said that in 2024, 92% of healthcare organizations reported cyber attacks, and nearly 70% saw patient care impacted by these. I wouldn't want to be a victim of that breach, certainly not. So what did we do in response, right? So in January 2025, there was an announcement by the US Department of Health and Human Services that proposes updates and a modernization to the HIPAA security rule. I personally think this is much needed since the last big overhaul was in 2013, and we certainly know technology in the landscape has changed since then. The proposal of the notice of proposed rulemaking, as it's called, so this is not quite in HIPAA yet, but this is just a proposal, marks a significant modernization in terms of documentation, testing, and oversight across the healthcare sector. And we are likely to see this finalized and actually put into practice in HIPAA end of this year, probably beginning of next year, maybe, and there'll be around a 24-month implementation period. So if you're starting now, you have probably a year and a half to get your act together when it comes to these new rules. But considering we know how bureaucracy works, it doesn't mean that the threats aren't there, right? Like, protect yourself now, even though you have a year and a half to do it. And we certainly, we discussed the complexity of these environments. It's not going to be a quick exercise. So I have picked out here just three significant changes or updates, a sample from the proposed strengthened security rule that was, very much in response to new breaches that we're seeing and new healthcare outages that we're seeing. Like, for example, the Change Healthcare attack last year in 2024 impacted nearly 190 million Americans. Their data was left unprotected when attackers gained access to the network using compromised credentials for a server. So this is a very, real issue. So these updates focus squarely on infrastructure security itself, and they include things like I've mentioned the following on the slides: maintaining accurate asset inventories, creating and maintaining network maps to show how electronic personal information flows through the network, implementing authentication controls based on system sensitivity, encryption of the sensitive data at rest and in transit. And there's a spotlight on segmentation and even micro-segmentation if you're there, but segmentation as a way to separate your more sensitive and non-sensitive systems. And the message is clear. Infrastructure and visibility and control are not optional. These are baseline expectations. And we should definitely note that Tier 4 penalties for HIPAA, which include willful neglect, so just ignoring that these rules are going to change, can be in the millions of dollars per violation per year. So definitely not something to be ignored if you're concerned about the balance sheet. And we are going to show you, based on those three examples that I mentioned, and there's plenty more in the HIPAA fact sheet which you can access online, but based on those just three examples that are relevant, super relevant to the IT network, we're going to show you how network assurance can deliver the evidence you need to prove that your security posture is as you need it to be. So as Zach prepares to demonstrate some of this for us, let's ask our audience one more poll question. So poll number 2, let's see if we have it up. So, okay, yeah. How confident are you today into your current visibility into systems that handle electronic personal health information? And don't worry, we won't disclose if you are not sure or not confident and you know that visibility gaps are a concern. We will not share that. Before we move on to the demo, let's share the results of the first poll. Okay, so 40% for keeping up with evolving requirements. Yes, they are changing all the time. We've got a couple of votes for proving compliance consistently and then coordinating across teams and tools. Yes, having that one language that you're speaking to security and network teams through is very, very challenging. I agree. All right, so I'm going to stop sharing and let Zach take over for our demo.
All right, everyone. You should be able to see my screen here as I jump into the demonstration. But as Christine mentioned earlier, at IP Fabric, we really specialize in inventory and asset management. So as I start this demonstration, I just wanted to show you after IP Fabric's discovery process is completed, here's where we'll have your full network device inventory. So aligning with those HIPAA compliance, keeping an accurate accounting of all of your assets. Now, once I have my assets discovered, what's some of the residuals with IP Fabric? What's some of those benefits that we get that align to our HIPAA needs? And as Christine brought out, it's those network maps or network diagrams. And here at IP Fabric, once that discovery process is run, we have your device configurations and how they're connected. IP Fabric can create these dynamic diagrams. So as I just show you these diagrams, I have some cloud infrastructure as well as some different sites here. And as I zoom in, you may notice some interconnections with different routing protocols there. And as I scroll down, IP Fabric even gives me a look into my layer 2. Now, just to show you some of the value of these diagrams at IP Fabric and how they can help you achieve HIPAA compliance, they are fully dynamic and filterable. So just as an example, if I wanted to take a more in-depth look at one of my VLANs, let's say VLAN 333, and how I'm set up from a spanning tree perspective, if I turn on my filter here and click submit, now within IP Fabric, as I zoom in, I'm able to see which switch is my root bridge, as well as the states of the ports, which ones are in a blocking and forwarding state, as well as which way my traffic is allowed to flow.
So Zach, what I'm seeing here, sorry if I can ask one question, what I'm seeing here is that this is not merely just ticking the box of providing evidence to your security team that they need for HIPAA compliance, but it's actually providing the user a really deep understanding of the holistic state of the network so they can rectify anything that's not in compliance very quickly too, right?
Absolutely. And we're bringing all that together here in IP Fabric just to show you how we get a little more holistic look of our network. If I right click on this firewall here, click explore, just as one quick example, I'm able to see the exact device I'm using as well as what software version. So really able to patch up my attack vectors and any weaknesses in my infrastructure here. Now, also on top of our diagrams and the value that our diagrams bring, we also have a path lookup feature that corresponds right to our diagrams. So with our path lookup feature, we are able to monitor end-to-end how traffic flows in our network. So if you take a peek at the screen here, I am simulating some traffic across one of my sites over an MPLS link to a remote site in Prague. Now, IP Fabric can help you verify each step along the path. So as I click my first device here and click explore, I'm able to see exactly how my packet is moving from source to destination and the packet logic decision table in the middle. Now, as I scroll here and click explore on my firewall, as a part of this path, I'm able to get even more robust information. So once this packet gets to the firewall, I'm able to see my NAT, my route, as well as my access control policy that may or may not be blocking my traffic. So really great for verifying your paths, making sure you understand what your assets can talk to and where they lie in the infrastructure. Now, with our path lookup feature, IP Fabric really helps customers secure their data in transit. Now, what do I mean by that? Well, if you take a peek here, at this traffic flow. This is an on-prem environment. And I have a firewall here in red, which is illuminating something is blocking my traffic, my access control policy. But if I take a look at this similar path lookup here, and I am simulating traffic from one host across another site, this time into AWS infrastructure. Now, if you notice here, this firewall is in green, and as I right click on it and click explore, I'm able to verify my encrypted paths. So protocols like VXLAN, MPLS, but in this instance, IPsec, I'm able to see exactly when my IPsec tunnel starts to terminate, as well as the IP addressing used for the tunnel, as well as verifying I'm using secure protocols. So I'm not opening myself up to additional attack vectors.
Zach,
Also in IP Fabric. Yes.
sorry. If I wanted to share that information very quickly with my colleagues, what are some different ways that I could share that info?
Absolutely. So all of this information is fully exportable. So for an example, I can export my configuration straight to a JSON file. And once I have it here downloaded in JSON, I can easily share that with my colleagues or into API or my automation strategy for securing and automating my compliance loop and making my audits real easy when they come around.
Amazing. I love that efficiency win. And that also addresses one of the poll questions we had earlier where people mentioned, bridging that gap between teams, getting rid of some friction there would be helpful.
Absolutely, absolutely. We definitely try to bridge those gaps here at IP Fabric. And we also try to make this information very easy to have at your fingertips. So just as an example here, when it comes to your data in transit, we have full IPsec tunnel status. So we can troubleshoot if our tunnels might be down, as an example, or also are we using those approved algorithms for communication to make sure that we're secure. So our intent checks in IP Fabric also help you achieve that HIPAA compliance as well.
Sounds good.
And with IP Fabric's digital twin capabilities, it allows you to simulate traffic between any two endpoints. So this is really great for segmentation. What it allows you to do is assure or confirm that your traffic is segmented so you can have a consistent approach to managing your network, as well as making sure there's no unwanted communications between VLANs, subnets, or VRFs. As an example of that, under technology tables, our technology tables display all the discovery information in nice tables, nice neat tables that are easily digestible. But just as an example here, if I take one of my switches and look at how many VLANs total they have, and if I click on one of these and I can confirm I have 5 VLANs on this switch, which really is great for helping me visualize if I have any VLAN sprawl at a layer 2, which sites these VLANs belong to. And if I start seeing them in other sites, it gives me an opportunity to confirm my segmentation and assure I'm connected as I intended to be. Also, same for the layer 3. We're able to look at each VRF. So if we have VRFs that we only expect to be communicating with certain devices, we're able to see that here in IP Fabric. With a few clicks, we're able to see exactly where all those devices lie, where they should be communicating, and even down to a serial number level as well. Now, one thing that's really nice about IP Fabric specifically when it comes to segmentation and path verification is, once again, if you take a look at our intent checks, and as I scroll down to performance verifications, if I take a look at end-to-end path verifications, here is where I have the ability to save my paths that are of interest to me and confirm if they are flowing as I intended to. And if they're not, I can get a intent check in red saying, hey, something here in this path has changed. Before since the previous snapshot, it may require some investigation. So we're able to save the paths that are critical to us and see if we are passing and failing as we intended.
So we're skipping past that manic process of trying to gather this data from all different teams and pulling out the pen and paper, mapping that all through. We're just running a snapshot every day or multiple times a day on that sensitive part of our network that's underpinning the healthcare infrastructure that needs to be HIPAA compliant. And we're delivered this data, all this data you just spoke about, normalized, available, accessible daily.
Exactly. Well said, Christine. Thank you. And on our dashboards as well, we're able to see even some of our interface statuses as well, some of our hardware end of life milestones as well. So we're able to get ahead of that hardware life cycle and really plan for those additions as well down the road to make sure that we don't have any weak spots in our security as well.
Sounds good. All right, so as we wrap up the demo portion, I can tell you just briefly, we do have results in, and it looks like no one in the second poll was fully confident that they knew exactly the full visibility of where their electronic personal health data lives. We did get some somewhat confidence and not confidence though. So just wanted to share that as we wrap up here, Zach. Something like ipFabric could certainly raise the levels on that, I imagine.
Absolutely. And one thing I forgot to add, Christine, as well, I just wanted to share as well that ipFabric does allow for customization of the platform to align with your HIPAA needs. So as an example here, I'll just show you briefly, I have a sample dashboard for NIST 2 compliance, and I have my exact notifications from my special publication there of where I need to have my intent checks to align with that compliance. So I can do the same thing for HIPAA compliance as well. So I can create
with this new security rule.
Exactly. And these widgets and tabs can be specific to your environment. So not just generic checks, but as you understand your specific needs, with ipFabric, we have a custom dashboard so that all of your team can have the clarity of being HIPAA compliant, all from our single source of truth user interface.
Sounds good. So we do have a couple of questions in the Q&A, Zach. I wonder if we could tackle them just really briefly for our audience. And guys, we do have plenty of places that you can go for more information. You can certainly reach out to the team. You can ask a question now still. We do still have a few minutes for questions. And we have those docs available for you. You can also get a personalized demo. There is a button above our heads here that you can ask. And if you want specific information now and you really want to get in touch with the team, we do recommend just emailing us. You can email our colleague Matt at Matt Angelo. That email is in the chat now. And he will make sure that you get in touch with who you need to speak with. So, Zach, do you have some answers for those Q&A questions?
So it looks like the first question, how does ipFabric help detect lateral movement paths that could expose PHI during a breach? Well, we touched on it a little bit in our demonstration, but with ipFabric, you have the ability to run end-to-end path monitoring for every IP address or endpoint in your network. So with that, you can test every device, every IP address to see what all they have access to. So you can simulate where potential lateral movement could be damaging to you and then fortify your network.
Sounds good. I like that word, fortify, keeping it strong and secure. We have one more question.
That's the goal. One more question here. What happens when the network snapshot shows drift or deviation? Do you alert into existing SIM or SOAR? That's a good question. And at IP Fabric, we do have the capability of taking our data and integrating it with a SIM like Splunk or source system. So in the platform itself, we do have the ability to compare via snapshots changes between configurations or points in time. And then once those changes have been validated, we can then push them over to a SIM for full aggregation of what's going on in your network to really patch together all of your systems so you can have a complete look at your network.
All right. All right. Sounds good. Yeah. All right, guys. Well, we can give you another minute or so for Q&A. If you do not, if you do have more questions, please leave them now. Otherwise, please reach out to our team. You're more than welcome. We also want to highlight that we have a compliance ebook, a compliance hub, and a specific HIPAA compliance solution brief available for you in the docs that are linked in the docs section, and that has more in-depth information on everything we spoke about today, taking you through our exact security use cases so you can get more information. So I think that's us for today. I will share what some of those resources look like, and I will say thank you very much.
Hey, thank you all for your time and for attending.
Bye-bye.